Hi, everyone. My name is Carol, and just a little about myself. I am 57 years old. I am 5'7". My highest weight was 212. My current weight is 155, and I live here in Southern California, Orange County area, Lake Forest. And I wanted to talk about my lap band, which seems to be failing, uh, and I'm going to be getting a revision surgery to a bypass. So let me just tell you a little bit about my past here. Before I had Lapband, I was on Prevacid, which is a prescription anti-reflux medicine, and I was on that for about 10 years prior to the Lapband. Now, I had Lapband done down in Mexico because it was affordable, and I had a great doctor down there, and he did my Lapband, and that was 6.5 years ago. That was in November of 2008, and today is June 8th, 2015. So 6.5 years. The Lapband completely cured the acid reflux and the heartburn. I went off all the medicines for that, and I've been great. And I lost weight. I got down. I kind of fluctuated between 165 and 172. About 2 months ago, everything changed. I started having major acid reflux to the point where it was choking me in my throat. I would wake up choking and coughing, and I can't get my breath. It would happen 2 to 3 times a night, and one time it was so bad that I thought I was going to choke to death. So the other thing is anytime I eat anything, I burp, and I'm talking for 6, 7 hours, I will burp constantly. Also, I was unable to eat anything because ever since that reflux went into my throat, for some reason, I couldn't eat any solid food at all. So I have been drinking protein shakes pretty much every day since then, and water and a protein bar, which I can get down. But I am now down to 155, and I feel really good at this weight, and I don't really need to lose weight. However, my doctor ordered an endoscopy, and I had that done about 6 weeks ago, and they basically did a biopsy because I was afraid of Barrett's esophagus, which is a pre-cancer of the esophagus. Because of all the throwing up, I've done nothing but throw up for 6.5 years. I thought that was normal. I thought the lap band would be permanent. No one ever told me it wouldn't be. But all I've done is throw up, and then when I watch videos of other banded patients, I'm like, well, they're not throwing up every day. I did, every day. And then recently with, the waking up choking, I mean, it's life and death here. I've been sleeping on, propped up on 3 pillows ever since then. So for, 2.5 months, I've been propped up on pillows when I sleep so I don't choke. And the endoscopy, they performed a biopsy, and of course I just got the pathology report, and sure enough, I do have Barrett's. Like I said, Barrett's is a pre-cancer, and once you have it, it will never go away, and they're hoping for it to not progress to the point where I do get esophageal cancer. So that's my fear there. So they referred me to a bariatric doctor, and I went in and saw my Dr. Bellsberg up in Harbor City near Long Beach, and great doctor, 31 years experience. He tells me you wouldn't believe how many patients he's converting from Lapband to bypass because they're just failing, and he says, they're not permanent, and I didn't know that. So, I could have gotten the sleeve or the bypass, but the sleeve, if you've got acid reflux, is really not a good option because you will continue with the acid reflux. So he said the bypass is my best option. Also, he believes that I have a hiatal hernia, which he will correct during the bypass surgery. So I am scheduled for July 2nd to have the bypass surgery, and instantly my acid reflux will be gone. I won't have it anymore. And of course, I'll probably still have to get the endoscopies to check to make sure that the Barrett's is not progressing. So that will probably be a yearly exam I have to get now. But my purpose of having this revision surgery is not only to cure the acid reflux, but I don't want to regain and get bigger than I was before I had the Lapband, which, if they just took it out, obviously, we're human, we're going to be eating. And I've always, struggled with keeping my weight, where it's supposed to be, and I just couldn't do it anymore. So, the bypass will definitely keep me from gaining weight back, and I think I'll probably lose a little bit more, but then I think once everything's healed and I'm able to eat properly and not throw up all the time, I will probably gain some of that weight back and maybe hopefully stabilize at the 155, which I am now. So I'm a little nervous about the surgery, but I think it's going to be fine. And I'd like to do another video and give you an update when, I'm feeling better and let you know how I'm doing. So if you have any comments or if you want to get in touch with me, please leave a comment, and we'll see how it goes. And I'm kind of excited to not have acid reflux. To be able to lay flat again in my bed and not choke is, it's just getting in the way of living. So I'm kind of excited about it. And I hope you're all having a good day, and I'll let you know how it goes. Thank you. Bye.